Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, why do I have to fast to get lab work done? Asked by Stephanie Miller of Lexington, Kentucky. And here to help me answer that question is our lab manager at Family Practice Associates, Ms. Gwen Howard, and our lab coordinator, Sherry Carr. Welcome, guys.
Thank you.
Okay, I cannot stand to have my blood drawn. That needle comes at me and I just don't like it. But I will tell you, the staff at Family Practice does a good job at making me feel comfortable and at ease to do it. And we start out fasting. Gwen, what is fasting and why do you have to be fasting? Or do you have to be fasting?
For certain tests, yes, but not for all tests. So fasting for us is nothing to eat or drink by mouth for 8 hours. You can have water, not an excessive amount of water because you don't want to overhydrate. It does help the veins some for the phlebotomist if you do have some water, but be careful that it's not a flavored water or a carbonated water. People have always said in the past that you can have coffee, black coffee. Not anymore, because all of our coffees are flavored. So we don't know how those coffees have been processed or what has been added to that coffee that might affect your blood work. So some of your tests that might need to be fasting for would be maybe your glucose, your lipids, some of those types of things. And if you aren't fasting and you have your blood drawn, then your provider's probably going to have you repeat it before they make a decision on your diagnosis or give it a medication.
It's best to be clear before you get there.
Absolutely.
What you need to do. All right, now there's different blood. There's blood out of the arm, there's blood out of the finger. Is it different tests that make a difference on how you draw it?
It does. There's a few tests that are out there that are finger stick tests, but a lot of them are also with serum or with blood. You would prefer to do the blood or the serum test and have it drawn out of your arm because the specimen that we get out of your finger can have tissue juice in it, so it can be, your results could be abnormal and when they should not be. So we want to come back and have that repeated.
So now, Sherry, once we get the blood, it's not somebody off the street that runs it. It's really a complicated procedure, and these people are well trained in what they do.
Correct. So an accreditation body is ensuring that you have a certain level of education as it pertains to a testing environment. Moderate complexity would have a higher level of education requirement than a wave testing per se. And so that comes into mind, and it is a lot of complicated processes for having that checked and evaluated daily, weekly, monthly, yearly, all the time to ensure that quality.
Gwen, we do a lot of tests, and we have to get those results to the patient. Those tests occur overnight. Should the patient expect the results in an hour, in a day? What's a good time?
It depends on the test, obviously. If we're doing point-of-care tests, we're going to be doing those in the office. You're going to get those while you're there.
Like strep or flu?
Like strep or flu, that's right. Urinalysis, you should get that pretty quickly. Those types of things. Pregnancy test. But then when you start talking about blood work, it depends upon the type of test that we're doing and the number of tests that we're doing and whether we're doing it in-house or whether we're sending it to a reference lab. Probably 90-95% of the work that we actually draw, we do in-house. And most of that is done same day or the next day. So we don't hold a whole lot over. Anything that goes to a reference lab, obviously it's processed and they pick it up and they take care of it from there. So it depends upon that. So generally, most of the things that we do, you're going to get the results relatively quickly. Unfortunately, the provider needs to look at those results before we're going to give them to the patient. So that way you can give anything that you want to change.
But that patient should get the result, abnormal or normal. Doesn't mean no news is good news. It means it's no news and you need to hear it's normal.
Absolutely, you should be hearing that it's normal, and we should be contacting you with those normal results. If we don't, then call us. I mean, if you don't get it in a timely manner, call us.
Okay, it's great information. You guys do a great job at our lab. Thanks a lot.